Welcome to another episode from a Veterinary Medicine Digest. Today, we delve into a critical topic in companion animal health, high-rise syndrome in cats. This condition refers to the collection of traumatic injuries occurring when cats fall from significant heights, typically from windows or balconies of apartment buildings. It has been a recognized issue in veterinary literature since it was first described in 1976. While many cats remarkably survive these incidents, the injuries they sustain can range from mild to extremely severe, sometimes leading to tragic outcomes. This syndrome is particularly common in urban environments where tall buildings are prevalent, placing cats at a higher risk compared to those in more rural settings. Cats often engage in playful or hunting behaviors, like chasing birds or insects, before these falls occur. Our discussion today is based on a comprehensive two-part study conducted by Mario Candela Andrade and colleagues, which analyzed a substantial population of cats treated for this syndrome in Berlin, Germany. This extensive research aimed to clarify existing inconsistencies in the literature regarding the relationship between fall height and injury severity, as well as epidemiological patterns, including seasonal variations and architectural risk factors. The first part of their work focuses on the epidemiological patterns and associated risk factors of these feline high-rise falls.
That's right. Previous studies have presented a somewhat muddled picture when it comes to understanding high-rise syndrome, especially concerning how the height of a fall might influence the severity of injuries a cat sustains. Some research has suggested a straightforward, linear increase in injury severity with greater fall heights. However, other studies have pointed to a more complex, curvilinear pattern, where injury severity might actually peak at intermediate heights and then surprisingly decrease at extremely high falls. To add to this complexity, some investigations have found no definitive pattern at all, making it difficult to fully grasp the injury mechanisms involved in feline falls. Beyond the height of the fall, there's also been limited research on how various environmental and temporal factors, such as seasonal changes, the time of day, and even building design, might influence the frequency and severity of these accidents. For instance, while many studies in Europe and North America link a higher incidence of falls to warmer months, observations from warmer climates suggest a lower incidence during the hottest and most humid periods, possibly due to the widespread use of air conditioning leading to closed windows. These inconsistencies and gaps highlight a significant need for a large-scale, standardized investigation to provide clearer insights into the trauma patterns associated with high-rise syndrome. The study we're discussing today aimed to bridge these gaps by analyzing a vast dataset, hypothesizing that epidemiological factors like age, sex, seasonal variations, time of day, impact surface, and fall height would indeed influence the risk and severity of injuries.
Moving into the fascinating results of the first part of this study, which analyzed over 1,100 cases of cats treated for high-rise syndrome at a veterinary clinic in Berlin between 2004 and 2013. The researchers found that the European Shorthair breed was overwhelmingly represented, accounting for a significant 82% of all cases. The cats involved were relatively young, with an average age of 2.3 years, and their falls were almost equally distributed between male and female cats. Perhaps one of the most striking findings was a strong seasonal pattern. A substantial 77% of all incidents occurred during the summer months, which the study defined as April through September. Within this period, the highest incidence was observed in July, followed by August and June. Conversely, the lowest incidence was recorded during the winter months from October to March. The time of day also played a crucial role, with the majority of incidents, specifically 62.1%, taking place at night. The average fall height was found to be in the range of 8 to 15 meters. Furthermore, a significant majority of cats, 74.2%, landed on hard surfaces. Interestingly, the study also documented a small percentage of repeat incidents, with 1.4% of cases involving cats that had experienced two separate falls. These results provide a robust epidemiological snapshot of high-rise syndrome in a major European city.
These results offer critical insights, and the discussion section of the first paper truly delves into their implications. The observed higher incidence of falls during the summer months, peaking in July, August, and June, is a particularly compelling finding and aligns with several previous investigations. This is likely due to the typical absence of air conditioning in Berlin's residential buildings, meaning that during warmer seasons, people rely on open windows and balcony doors for ventilation. This increased exposure to the outdoor environment, where cats often enjoy basking in the sun or observing birds and butterflies, significantly contributes to the heightened risk of falls. The study also highlighted that the majority of incidents occurred during the evening and nighttime hours, specifically between 1800 hours and 600 hours. This pattern contrasts with some studies from other regions where accidents were more frequent during the day. The researchers suggest that in Berlin, this nocturnal peak might reflect the working hours of cat owners. During the day, windows and doors are often kept closed for security, but they are open for ventilation when owners return home in the evening, increasing the fall risk. Moreover, accidents occurring at night are more likely to be promptly observed and reported, facilitating quicker veterinary intervention. The prevalence of European shorthair cats, accounting for nearly 82% of cases, is believed to reflect the regional feline population and ownership preferences in Berlin, rather than an inherent breed predisposition to high-rise syndrome. These findings underscore the profound influence of seasonal, temporal, and environmental factors on the likelihood of feline falls.
Indeed, the architectural characteristics of buildings primarily influence the calculation of fall height rather than directly affecting the risk of falling itself. The average fall height observed in this study was 12 meters, which generally corresponds to approximately the fourth floor of a building. This finding is largely consistent with average fall heights reported in other studies from different cities, ranging from about 11.3 meters to 12.4 meters. However, some studies have reported lower average fall heights, potentially due to the inclusion of cats falling from even lower floors, while others noted significantly higher averages, likely reflecting the prevalence of very tall skyscrapers in certain urban landscapes, such as New York. The study's finding that most falls occurred from heights between 8 and 15 meters, corresponding to the third or fourth floors, aligns with the typical architectural trends found in cities like Berlin and Paris. The fact that the majority of cats, almost 3/4 of them, landed on hard impact surfaces is a critical detail, as biomechanical principles suggest that hard surfaces result in higher impact forces, leading to more severe trauma compared to softer surfaces which can dissipate energy more effectively. This aspect, along with the detailed analysis of injury patterns, is explored further in the second part of this study. The conclusions drawn from the first part of this extensive research emphasize the importance of targeted prevention strategies. Veterinary professionals are encouraged to educate cat owners about the significant risks of falls, particularly during the high-risk summer months and nighttime hours. Implementing preventive measures, such as installing window and balcony barriers, is highlighted as an effective way to significantly reduce the incidence of high-rise syndrome. Additionally, ensuring prompt veterinary care for injured cats can notably improve outcomes. These insights collectively form a crucial foundation for developing more effective strategies to mitigate the incidence and severity of high-rise syndrome in cats.
Now, let's transition to the second part of this comprehensive study, which meticulously examines the injury patterns and survival rates in cats affected by high-rise syndrome. This part builds upon the epidemiological findings, aiming to unravel the complex relationship between various risk factors, the specific types of injuries sustained, and ultimately, the cat's chances of survival. A fascinating aspect that influences survival in falls is the cat's innate air-riding reflex, an evolutionary adaptation that allows them to reorient their bodies mid-air to land on their feet. This reflex, along with factors like body orientation during the fall, force distribution, the impact surface, limb positioning, velocity at impact, body weight, air resistance, and even meteorological conditions, profoundly influences the outcome. The characteristic triad of injuries often associated with high-rise syndrome includes nosebleeds, a traumatic cleft palate, and the presence of air outside the lungs in the chest cavity, known as pneumothorax. However, the spectrum of injuries is much broader, encompassing various types of trauma to the chest, abdomen, and spine, as well as fractures and dislocations of the limbs. A major challenge in previous research has been the inconsistencies in relating fall height to injury severity, with conflicting findings across different studies. Many existing studies have also been limited by small sample sizes, diverse research designs, and regional biases, leaving significant gaps in our understanding. This second part of the study aimed to address these limitations by analyzing a large feline population over nearly a decade, seeking to identify key prognostic factors that influence outcomes and provide actionable insights to enhance clinical decision-making. They also adapted an injury severity scoring system to incorporate radiographic findings, which is a crucial step towards a more practical and reproducible evaluation of trauma severity.
The results from the second part of the study revealed common and critical injury patterns among the 1,125 high-rise syndrome cases. Circulatory shock was a significant concern, observed in nearly half of the cases, specifically 48.6%. Thoracic trauma was the most prevalent major injury, affecting 58.3% of cats. Within thoracic injuries, lung contusion was the most common, observed in 46.8% of cases, followed by pneumothorax, or air outside the lungs, in 24.6%. Orofacial lesions were also highly common, occurring in 51.1% of cases, with abrasion wounds, nosebleeds, and mouth bleeding being frequently observed. Interestingly, tooth injuries and cleft palate were also noted in 13.1% and 12.8% of cases, respectively. Musculoskeletal injuries were almost universally present, affecting 92.4% of cats, with limb fractures occurring in 47.2% of all cases. Hind limbs were slightly more affected than forelimbs, and pelvic fractures were observed in 11.1% of cases. Other less common, but serious, injuries included traumatic brain injury in 2.8% of cases, blunt abdominal trauma in 14.6%, and spinal cord lesions in 4.3%. When it came to severity, the study used a modified scoring system, classifying injuries from minor grade 0, meaning clinically and radiographically lesion-free, to severe grade 4, which encompassed life-threatening conditions like multiple extensive lacerations, skull and or vertebral fractures with neurological deficits, and abdominal trauma with shock.
The analysis of injury severity in relation to various factors provided crucial insights. Importantly, the study found a statistically significant association between age and injury severity, indicating that younger cats, those under 1 year of age, experienced less severe injuries compared to older cats. This aligns with observations in other trauma studies where older animals tend to have worse outcomes, possibly due to pre-existing conditions, reduced physiological reserves, or lower tissue elasticity. In contrast to some previous beliefs, this study found no statistically significant difference in injury severity based on a cat's sex or body weight. This suggests that a cat's weight alone does not dictate the outcome of a fall, challenging earlier statements that heavier cats might suffer more severe injuries. A particularly significant finding was the relationship between fall height and injury severity. As fall height increased, the proportion of severe injuries became more prominent. For example, in falls exceeding 24 meters, 100% of cats sustained severe injuries, with no mild injuries recorded. This indicates a linear increase in injury severity with greater fall height, which contradicts some previous studies that reported a curvilinear relationship where severity decreased at extreme heights. Furthermore, the impact surface played a vital role. Cats landing on soft surfaces sustained less severe injuries compared to those landing on hard surfaces, with 75.2% of cats landing on hard surfaces suffering severe injuries, compared to 50% on soft surfaces. This underscores the biomechanical principle that soft surfaces dissipate impact forces more effectively.
The survival rates reported in this study provide a beacon of hope amidst the severity of high-rise syndrome. The overall survival rate was remarkably high, at 87%. This figure aligns well with comparable and even slightly higher survival rates reported in previous literature, which typically range from 83% to 92%. However, it's important to acknowledge that this figure might still be an underestimate of total fatalities, as some cats may die at the scene and never be presented for veterinary care, especially given that cat ownership in Germany does not require official documentation of death. Of the 13.3% of cats that did not survive, a significant portion, specifically 7%, were euthanized due to the severity of their injuries and a poor prognosis. Additionally, 1.4% were euthanized at the owner's request, primarily due to the high costs associated with treatment, and 4.9% unfortunately died despite receiving veterinary care. A crucial finding was the significant association between fall height and survival rate. Survival rates remained above 80% for falls up to 21 meters, but dramatically dropped to approximately 60% for falls exceeding this height. This suggests a critical threshold beyond which the prognosis significantly worsens. The study also highlighted the strong correlation between shock, injury severity, and survival rate. Cats presenting in shock tended to have more severe injuries and a lower survival rate. Interestingly, cats that received prior treatment elsewhere or presented more than 4 hours after the incident were less frequently in shock than those without prior treatment and are presented within 4 hours. This could suggest that early veterinary intervention, even initial stabilization, plays a critical role in improving outcomes.
These findings truly provide a comprehensive understanding of high-rise syndrome, offering invaluable insights for both veterinarians and pet owners. The study confirms that musculoskeletal, thoracic, and head injuries are among the most frequently observed traumas, which is consistent with prior research. The overall high survival rate, despite the severity of many injuries, underscores the importance of prompt and effective veterinary care. The clear demonstration of a linear increase in injury severity with greater fall height is a pivotal contribution, resolving some of the previous inconsistencies in the literature and aiding in more accurate prognostic assessments. The observation that younger cats sustained less severe injuries compared to older ones points to potential differences in physiological resilience or impact absorption, warranting further investigation. The strong correlation between shock and both injury severity and survival rate emphasizes that early and aggressive shock therapy is absolutely essential for improving patient outcomes. The prevalence of lung contusions as the most common thoracic lesion further highlights the importance of routine chest radiography in all high-rise syndrome cases, as clinical signs alone may not always reveal the full extent of internal damage. While this study is one of the largest to date on high-rise syndrome, it does have some limitations, including its retrospective nature, reliance on owner-reported information which can introduce recall bias, and the fact that the study population was limited to a single urban area, potentially affecting the generalizability of findings to other regions. However, the rigorous data validation and statistical analyses employed help to ensure the robustness of the findings. Ultimately, this research strongly underscores the necessity of targeted prevention strategies, such as the installation of window screens or barriers, especially in urban environments. Educating cat owners about the risks and the importance of timely veterinary intervention after a fall are crucial steps to reduce the incidence and severity of high-rise syndrome and enhance feline safety and well-being.
Thank you for listening to the Veterinary Medicine Digest. If you're enjoying this, remember to like, share, and subscribe as proceeds from this channel go directly to providing vital veterinary care for animals in need. Even a small amount can transform an animal's life and ease an owner's burden. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.